Located just off of Newberry Road as part of the North Florida Regional Medical Center is the Florida Heart and Lung Institute, where they deliver the highest quality of expert cardiothoracic care.
Florida Heart and Lung Institute is special because I think it's a comprehensive group of very dedicated individuals who every day come to work hoping to make every patient's care as individualized as it can be, try and structure every procedure and every care plan to be as minimally invasive and as pain-free as it can be for the patient. Hyperhidrosis is a really interesting condition, and it literally means excessive sweating. When we think about that, it can be excessive sweating of the hands, the feet, the armpits, or even the face. It's really uncertain what causes hyperhidrosis. What we do know is there's an easy surgical cure that almost always takes care of the problem in specific sweating patterns. There are different types of hyperhidrosis. There's both primary and secondary hyperhidrosis. Primary meaning they've had it their entire life. Those respond very well to surgical intervention. Secondary meaning they developed it in their adult life, usually because of some other cause. Those often are not as responsive to surgery. Patients of all ages can have hyperhidrosis. Most commonly, we treat children in the 8, 9, 10-year-old range up to full-grown adults, perhaps as old as even 50 or 60 years old. Patients with hyperhidrosis face a lot of challenges in life. It impacts them socially, particularly when they try and hold hands with loved ones. It can be an occupational hazard, particularly if they do something where they have to work with their hands a lot, wear gloves a lot, or even shake hands with the public. The difficulty that they encounter in daily life is often underestimated by those even close to them. Especially for young patients, it can be very, very difficult. In addition to the social issues, there really are secondary health concerns. Often the chronically moist hands and feet can develop fungal infections or other complications. And additionally, there can be some safety issues, such as difficulty even driving a car safely because their hands slip on the steering wheel. Hyperhidrosis is diagnosed by the combination of the appropriate history and then a physical exam demonstrating it. In some cases, we have to rule out some of the other things that can cause secondary hyperhidrosis, but usually it's relatively straightforward to diagnose. There's a variety of treatments available for hyperhidrosis. The initial treatment is almost always topical ointments or creams in an attempt to dry out the areas that sweat too much, but often these become ineffective over time. The only long-term successful treatment is surgical. The surgical procedure to treat hyperhidrosis is really very straightforward. It involves looking inside the chest with a camera and a small instrument through 3mm incisions, and we work directly on the autonomic nerve that causes excessive sweating. We often are able to discharge the patients within a couple hours of the procedure, and they can essentially resume normal activities the next morning. Because it is minimally invasive, most of the patients are able to just treat it with ibuprofen and maybe some Tylenol. Life after surgery for hyperhidrosis should be exceptionally improved. First and foremost, the social issues should go away. From a medical standpoint, the fungal and bacterial infections they may have suffered with should be able to be cleared up. And from an occupational standpoint, they often then become uninhibited by their condition as far as their ability to perform their job. One important message for the patients to hear about hyperhidrosis is that they've suffered with it for a long time, and there's a good solution out there, and that they can go back to having a normal life and not have to deal with all of the issues they've dealt with. It's one of the reasons we created the Hyperhidrosis Center at North Florida Regional Medical Center. We hope to allow those patients the opportunity to have a lifelong solution for what's been a chronic, difficult condition.